Healthcare in India, rarely an election issue despite limited access. Welcome to Inventiva, I'm Oishi Banik, back with a new story. In India, health-related public policies and healthcare infrastructure have often been a matter of discussion among policymakers, yet they rarely become a political issue. However, it would be a mistake to imagine that citizens do not care about health facilities. Years before the ongoing pandemic drew attention to these issues, a study by Lokniti-CSDS in 2019 found that people expect the government to take maximum responsibility for providing basic medical care. But when it comes to voting, health never becomes an electoral issue for voters, nor do political parties generally focus on health infrastructure in the manifesto or campaign. Health in elections. In the several rounds of post-election studies by Lokniti-CSDS, less than 1% of voters have said health was their consideration while voting. It was assumed that during the current pandemic, voters would prioritize health as an election issue. But this has not been the case. The Bihar Assembly elections were held just after the first wave of COVID-19. During the post-election survey, less than 1% of voters considered health as an issue while voting, which was not very different from the finding of the last post-election survey in Bihar 2015. In early 2021, when India faced a second wave, elections were held in 4 states. Here too, less than 1% of voters considered health as an election issue. Access to healthcare. In the SDSA 2019, the enumerators were asked to observe the availability of medical facilities in the surveyed locations. It was found that 70% of locations have public healthcare services. Availability was less in rural areas to 65% compared to urban areas 87%. The enumerators were also asked to survey whether people can reach healthcare facilities by walking or need to use a transport. In 45% of the surveyed locations, people could access healthcare services by walking, whereas in 43% of these locations, they needed to use a transport. Proximity to healthcare services is higher in urban localities. 64% of the enumerators in urban areas observed that people can access healthcare services by walking, while only 37% in rural areas can do so. Public health experience. In a study conducted between elections by Lokniti-CSDS in collaboration with Azim Premji University during 2016-19, 30% of surveyed people shared negative experiences in availing public healthcare services. It was more so for people from marginal sections who avoid getting treated sometimes due to lack of infrastructure and monetary resources. In the State of the Nation Survey (SONS) conducted in 2018 by Lokniti-CSDS, people were asked if they have ever taken a loan for medical treatment. 1/4, which is 25%, confirmed taking a loan, and this proportion is higher among people belonging to scheduled caste and the poor. Scarcity of funds further discouraged them from taking medical treatment. 43% of respondents said they or someone in their family went without medical treatment. This trend was mainly observed among people from scheduled caste and scheduled tribes. More than half the respondents in these sections said so. At the same time, 47% of people living in rural areas said that they went without treatment. These findings indicate that healthcare system in India needs to be made accessible to the needy and people living on the margins of society. The absence of positive experience with public healthcare not only pushes people towards private healthcare facilities, but also pushes the issue of health out of public political considerations.